because of the length of the game and sudden change of pace that it involves. Some test cricket involves the whole day, T20, couple of hours of game. So shorter to the game, the intensity of the sport is really high. So it is the multi-dimensional sport in which the players engage in wide range of diverse activities like batting, bowling, fielding, infielding, catching, and throwing, and wicket keeping. So the injuries in cricket tends to fall in two main categories, like overuse injuries or repetitive injuries and impact injuries. The overuse injuries are predominantly in bowlers and fielders who have to throw the ball frequently during matches and training. And impact or collision injuries that mostly occur with the batsmen and to the other players sometimes, that is in bowling and fielders, mostly the fielders, as a result of direct contact with the ball, another player on the ground or the boundary line. So in general, the injuries to the upper limb accounts for around 25 to 32% of all injuries. Such injuries particularly occurs in fielders because they have to throw the ball continuously. Injuries mostly occurring to the shoulder joint, that is for the upper extremity, mostly the predominantly on the shoulder joint is involved mostly because of the throwing activities and is predominantly in fielders and bowlers. So the injuries in cricket is mainly we divide the injuries in two categories, acute and chronic. For the upper limb, mostly the fielders and wicket keepers are involved, fielders for acute injuries. Lower limb injuries, fast bowlers, batsmen for acute and both chronic. Low back, mostly predominantly we see low back injuries happens to be in fast bowlers and abdominal injuries also in fast bowlers, and that is too chronic. So what are the potential risk factors for the fast bowlers to get injured? Let me tell you, fast bowlers are the ones who are most frequently injured in the field of cricket. So we'll get into the detail how it happens. Inadequate physical attributes, that is lack of physical conditioning, leads to injury. Poor bowling technique, maybe the bowling technique is not good, that the balance of the body is not maintained. That is some undue stress is coming with the soft tissue leading to injury. High physical demand, too high, too much of training, too much of frequency of the training, lack of recovery leads to injury. Lack of flexibility, hamstring and low back. Flexibility that is very, very important for the fast bowler because they have a huge amount of workload that is coming, an eccentric amount of workload that is coming on the muscle, especially the hamstring, while running to make a, while bowling the overs, while running on the field. So if there is lack of eccentric strength on the low back and hamstring leading to injury. Lateral flexion, posture during bowling, and reduced lateral slide of the abdominal fascia, anterior abdominal fascia. Increase in shoulder counter rotation, that is the alignment of the shoulder between the back foot and the front foot contact. If there is increase in counter rotation, that leads to injury. Knee angle at the ball release, when at the when the front foot lands to make a delivery, the front foot should be flexed. If there is full extension of the leg, it increases the chances of injury. Overuse, as we said, that is basically the workload we are talking of in this high number of deliveries bowled, back-to-back matches, enforcing the follow-on a test match, and spike in acute workload. That is too quick increase in workload, too many deliveries bowled, too many matches played leads to overuse and leads to injury. Increased stride length to height ratio as well as high ball release. This also leads to injury. Inadequate warm-up and return to play match too soon after experiencing an injury. So the rehabilitation is not completed and the player returns too early on the field leads to injury. We have many examples that I've recently seen. For example, Jasprit Bumrah, who has been returned on the field too early. Again, he got injured. Again, he went out and start training again. So there are multiple examples of the players returning too soon after experiencing an injury. Overload in a run-up, delivery stride, follow through, as well as incorrect foot placement during delivery. That is lead to injury. Repeated trunk rotation and a mixed bowling action causing abnormalities to the spine. That is alteration in the biomechanical technique of the bowling. An increase in amount of cricket being played as and an increase in the risk of injury associated with T20. T20 cricket is a very high intensity event that is happening, and that leads to more injury, risk of more injury. So the player has to be conditioned accordingly. What are the potential risk factors for a batsman? Mostly the lower limb injuries are due to running between the wickets. Overuse injuries are due to introduction of T20 cricket. As I said, it's a high intensity activity, high intensity format. So the player has to be conditioned or else it leads to overuse injuries. Lack of stretch, flexibility, strength, and cricket specific training and impact injuries. That is the hit, direct contact with the ball, bat, or other players, or lack of protective equipment. Potential risk factors for shoulders, muscle strain in the lower limb. Muscle strains are more common in quadriceps and hamstrings due to explosive movement on the field and impact injuries by the ball player or due to any other partial reason. So now let's talk in detail what are the common injuries that happens in particular region, that is in shoulder. Number one, the cricketing activity most often associated with shoulder injuries is fielding, followed by bowling and then batting. The fielders are more prone to shoulder injuries because the injuries happen to the shoulder are mostly due to throwing, as I said earlier. Throwing is the first and number one cause of shoulder injuries. Overuse of shoulder when throwing repeatedly during fielding can lead to problems such as tendinitis of the bicep tendon, tear of the supraspinatus tendon, or even degenerative changes to the rotator cuff muscle. Now, a brief about the mechanism. During the acceleration phase of the bowling action, the external rotators are contracted eccentrically in order to accelerate and control the arm. So the eccentric strength of the external rotators are very, very important to prevent the injury happening during the acceleration phase. Thus, an external rotator weakness leads to impingement syndrome. When there is a relative difference between the eccentric strength of the external rotator and the internal rotator, it results in migration of the humeral head. And this leads to decrease in subacromial space, which in turn causes impingement to the rotator cuff tendon. So within the shoulder complex, there is a subacromial space. Within that subacromial space, you find that the tendons of the rotator cuff passes. So when there is a relative difference between the strength of the external and internal rotation, when there is an imbalance, there is a displacement of the humeral head superiorly up. And when the humeral head glides up superiorly, it reduces the space, which is called subacromial space, and it turns and this leads to impingement syndrome. Therefore, the fast bowler should be advised to strengthen their external rotators for about 66 to 100% of the internal rotator concentric and eccentric strength respectively. In the end of the video, I'll be showing you what are the common exercise which you can be incorporated in for the shoulder joint to prevent its injury. Elbow. Improper batting and bowling technique as well as inappropriate equipment such as bat, if they are too heavy, that put unnecessary strain on the elbow, causing tennis elbow or lateral epicondylitis. Throwing mechanism required by the both fielders and fast bowler is a whip-like motion of the arm, which places repeated stress on the traction strain on the shoulders and elbow joint. So elbow condyle exercise is vulnerable to injury while bowling if the player places an undue stress on the elbow to increase the speed of the ball. So this is very, very common injury because of the lack of proper biomechanical technical problems. The radiological changes in the middle epicondyle of the humerus causes excessive valgus play as a result of overuse are referred to as little legger's elbow because they have been described in a baseball player, specifically pitchers and catchers. And a similar pattern has been seen in adolescent cricket players.